The white patch that you don't want to stuff up is what we call leukoplakia. And leukoplakia is a white patch which is due to mucosal trauma. And the main form of trauma that we're concerned about is the trauma that's environmental, such as from cigarettes and alcohol, that leads to pre-malignant and then malignant changes. So some leukoplakic patches don't wipe off of tongues, and they are the ones that are of great concern. And then there's a whole range of other oral pathology things. I won't go into the boring details, but things like lichen planus, for example, another cause of the striations and so forth, depending on what variation of lichen planus they've got. Which usually affects the cheek. Occasionally, comes over and travels onto the tongue as well. So, in terms of typical white furry tongue, if it scrapes off, think of thrush. If it doesn't scrape off, think of dehydration. Think of mouth breathing. And then the medical history and so forth will help clarify that. So, hopefully that answers that and gives you a little bit more of a definite answer. Next one we've got here, we've got chronic tonsil inflammation, inability to concentrate in class, and ADHD symptoms. Okay, so we've got a few different elements to that question of sorts. So let's start with ADHD. ADHD is a reasonable starting point for us. So with ADHD, that is a true condition. We'll start with a sensible starting point. That is a true condition. It's defined by criteria as to what makes ADHD. Now, one of the problems we've got with ADHD is that kids that have sleep-disordered breathing can also fulfill the criteria of ADHD. They have trouble with their concentration, their behaviour, their attention. Children with ADHD may actually even have both. So I always sort of think that with a child that's looking at the diagnosis of ADHD is to have a radar of sorts to be on the lookout for breathing and sleep problems. And the reason that's important because when we actually critically review ADHD diagnoses, at 25%, maybe as high as 50% of children diagnosed as ADHD actually have airway problems.